Okay, Dr. Zadeh, so my question for you today is what should someone expect after dental implant surgery?
After dental implant surgery, you should remember that since you've had surgery, you'll be very sore. So prepare for some liquid meals for a couple of days. Protein shakes are great. Those Ensure cans that you find in the markets, those are very good meals for the day or two that follows implant surgery. Now, of course, it depends on the extent of that implant surgery. If it's one or two implant in one corner of the mouth, after second day you can start chewing on the other side and basically go on with the normal meals. But if it's all around the mouth, then you should expect to be on soft diet for 5 days, 10 days, depending on what the instructions are and what the extent of the surgery has been. So you definitely are going to be given antibiotics, and you must take the antibiotics. It's very important. In the mouth, it's not possible to disinfect the area before making any incisions or before doing any surgery. So if you get surgery in your mouth and do not take antibiotics, the chance that you get infected is very, very high. Needless to say, if it gets infected, you will not only have to get more and more antibiotics, but your healing period will be extended twice or three times over. So you will be sore, you will have to take the antibiotic, prepare to have a liquid meal for a few days. Limit your talking, especially if it's in the front. Remember, as we talk, we move our lips, and if you've had an implant in front of your mouth, every time you move your lip, it's like pulling on the side of the wound, and that will definitely cause more swelling. And the discomfort you're going to have following implant surgery is mostly from the swelling, and the swelling will depend on how much you rest or don't rest it in the first day or so. Usually the worst day after implant surgery is the third day. So when you go home the first day, you're going to feel okay. I mean, you will be sore, but you're not going to feel that bad. Second day, you'll find that you'll start swelling up, which is completely normal. The third day is the worst day, that you feel most swollen and you feel beat up. That's normal reaction of your body, because your body is beaten up, by surgery, and your body is bringing all soldiers and all kinds of cells to the area to fight this trauma and start the healing. So that's going to all be at their peak on the third day. From fourth day on, you're going to start feeling better, because that's when the body will have done the peak of work and will start to take the inflammation and the cells that are needed to fight this trauma away, and you're going to start feeling better. How you feel after the third day on will depend on how much you have rested the first 2 days. I always say, first day or two you must rest, and then you will have easy healing 5-6 days later. If you do not rest the first day or two, then you will have a very hard healing, and it'll take about 2 weeks for you to get comfortable again.